Hey everybody, thank you for being here. We have a very special guest today, which I'll get to in a minute, but I'm Valerie Johnson. I'm a physical therapist and I specialize in Parkinson's disease. I have my own practice here in the Dallas-Fort Worth area, specializing in balance issues, including dizziness and Parkinson's. So I'm really excited to introduce our guest. Her name is Ashley Stafford. She's a licensed clinical social worker and she's an expert in mental health. And today she's going to help us identify symptoms of anxiety and depression and apathy and grief associated with Parkinson's disease and just in life. Mm-hmm. And also, how we can manage it. So hopefully you guys will have some good questions for us. Please do post any comments or questions on Facebook and we will address them at the end.
Yeah.
And let's just get started.
Okay, let's do it.
Okay. So I'm sorry. We know that Parkinson's and depression is very common. Also, we know that can be one of the first symptoms of Parkinson's before motor symptoms even present themselves. Mm-hmm. So we want to make sure that you're aware of it, and so she's going to tell us about that. There are physiological changes in the brain when you have Parkinson's disease, and that affects depression. So let us get to Ashley. So please tell us, Ashley, what do you specialize in?
Sure. So I have had a lot of experiences over my career in mental health. I've worked with the homeless. I've worked with traumatized children and adults. I've worked in geriatrics. I've worked in hospice care, and currently I am working in a psychiatric hospital, and I have my own private practice here in Fort Worth called Stafford Healing, and I see adults primarily and couples. So I love working with trauma, I love working with grief, I love working on a deeper emotional level. For anybody who comes into my office, I think that's really important.
Okay, I think we're back on. Sorry about that, guys.
I still look good. Do I still look?
Okay,
great. I still look good. Okay. So that's my specialty. I really just love people. So any chance I can get to affect healthy change in their lives is really special to me. So I'm excited to be here. Thanks for having me.
Thank you for being here. I'm so excited. So will you start by defining depression for us and
Sure.
symptoms of depression versus apathy?
Sure. So depression kind of comes with these thoughts like, I'm a burden, I'm a failure, I'm kind of like, it's like I'm worthless. And that typically is associated with physical symptoms too, like loss of appetite, sleep problems. And typically those symptoms will last consistently for about 2 weeks, every day or almost every day. Apathy, so to kind of touch on depression and apathy, I want to talk about anhedonia, which is like a fancy term to basically mean lack of pleasure in most activities or activities you used to have pleasure in. So anhedonia is this idea that, you may have really loved going to the pool with your grandkids, or you may have really loved going on a walk with your dog, and now you don't find any pleasure in that activity whatsoever. It feels almost meaningless to you. Whereas apathy is a lack of motivation. So anhedonia is a lack of pleasure, and apathy is a lack of motivation. Anhedonia can be a symptom of depression, and it can also be a symptom of apathy. So these things are really intertwined. I think the important thing about touching on them and understanding the differences between them is understanding your symptoms so you can treat your symptoms properly. And I think it just helps to be informed. I think we all feel more empowered when we're informed. Mm-hmm. I think with depression too, it's important to note that are we going to talk about the treatment options now?
Let's come back to that.
Okay, let's come back to the treatment options.
Okay.
But that's the difference.
Okay.
Between those things.
So I think that's really good because I know apathy is something that we hear about a lot in physical therapy. Mm-hmm. They just, people will tell me they just have a hard time getting themselves to exercise.
Yeah. Me too.
So I mean, like,
Yeah,
really,
me too.
you can't like treat the body without treating the mind, and so I think it's really important to collaborate with a mental health professional, especially because there are physiological changes in your brain going on. It's not your fault. Just like having Parkinson's isn't your fault.
Right.
But you can just approach it from treating all the symptoms of the disease, both motor and
non-motor symptoms,
symptoms.
Because mental health the brain is an organ. Like, let's not forget that. I think we kind of see it as a sense of self, which it obviously encompasses that. But I think that sometimes we just feel like if we have these feelings, like we're not motivated or we feel depressed, that like it's inherently like it's like inherently bad, like we're inherently failing in some way, and that's really not true. I mean, the fact of the matter is our brain is an organ and it functions in a certain way, and when that functionality is interrupted, then we have to treat those symptoms. It's a physical occurrence in the brain. Yes. We have to remember that. It's not some kind of like lack of or character deficit of you that you're having those issues, and I think that's really important for people to understand.
And I think people feel like they're not able to handle it.
Right. Like, why can't I handle it? Why can't I be better? Why can't I fix it? What's wrong with me? Yeah. Those are normal thoughts to have.
And the depression and anxiety have symptoms. These are symptoms that you can treat. They're actually quite treatable. We're going to get into the treatment options later. But it's good to be able to identify those in yourself and just not take it too personally. It's hard to, I feel like it's harder to separate yourself from your emotions. Can you talk about that?
Yeah. I mean, yeah, of course. I mean, I think we are emotional creatures. Like, we have our emotions drive us. Our perceptions of ourselves and others are drivers in our behavior. And so when we feel somehow less than, in some way, less than what we used to be, less than the person next to me, less than what I expected, then that kind of can, if we're not careful, that can become a narrative of who we are. And I think that's where you have to be careful, is that when we have problems in our life, it doesn't make us less than. What it makes us is a human being. And I think we were talking about this earlier before we did this, is talking about the idea that we really need each other, and the idea that when we are feeling less than, to have someone to reach out to does not make you weak, it makes you human. And there's plenty of research out there to support that too. There's plenty of research that shows that human beings need love, connection, and attachment like we need air to breathe. So when we feel less than, that's why our community is there, because that's human nature to like reach out and hold your hand and say, like, I need a little bit of help right here, and so feeling less than is just a sign, hey, I need a little support, and that doesn't make me bad. It doesn't make me bad in any kind of way. It just makes me human, and
it's an opportunity to get closer to other people.
Yeah, absolutely.
People that you love.
Absolutely, it's an opportunity to be vulnerable. And vulnerability, if anybody's a big fan of Brene Brown, which I am, she's amazing. She has a ton of TED Talks, and she talks about how vulnerability and experiencing vulnerability in a really honest way provides us the opportunity to experience love and beauty in life in a way that we never thought we could. Because when we open ourselves up to other people and be vulnerable, we invite them in to care for us, and that's a really beautiful experience.
That's awesome. Okay, so before we move on to how you address these symptoms and issues, so would you talk about grief a little bit?
Sure. So grief is different than depression in a couple ways. So depression is a group of symptoms that are resultant of a deficiency in serotonin and norepinephrine in your brain. That can be treated with various medications, which we'll get to later. Grief is a natural and normal response to loss. Grief can be primary, which is kind of like the idea of losing a parent, a spouse, a child, a friend. And then there's also secondary loss, which is the idea of, and this is just one example that I think is particularly pertinent to Parkinson's, is this example of the loss of the expectation, the loss of what I thought my life would be like when I retired. The loss of, well, can you speak to that, Valerie? Like the loss, as far as from a physical therapy perspective, that's secondary loss, like that you've seen with Parkinson's patients.
Sure. So this is something we see in physical therapy, I think, which is why it helps to collaborate. So losing function, losing your ability to move, your body's changing, your ability to get on the floor and play with your grandchildren is changing. You can't crawl anymore. Weird things that you can't skip anymore. These really are things that you can address in physical therapy. The Parkinson's therapy is the most exciting therapy I've ever done, because all the time people do things that they didn't know they could do. The truth is, you have the strength and range of motion to do these things. You just need to use a little bit of creativity and pizzazz. But Valerie. so anyway, like it's just really, really fun to watch. So you can work on things like that in physical therapy, which is why this is a good segue. But that's an example of things that people will lose and maybe weren't expecting when they retired to have to deal with.
Or even expecting when you get the diagnosis of Parkinson's. Like, if you have that diagnosis, like the idea of secondary loss, I mean, of course, I'm sure it's very shocking, or almost a lot of people probably feel very numb or like surreal or like an out-of-body experience when you get a diagnosis that is a chronic disease. But as things become more realistic, as things kind of show you in your day-to-day life what you're unable to do, or hey, I used to be able to do this, why can't I do this? And then that feeling of grief, of losing those things is secondary loss. And it comes in waves. So some days you're going to have really good days where you're going to be like, I am feeling positive. I don't care. I have Parkinson's and I can, I'm going to like rule the world. And then like maybe 2 days later, you really just feel kind of defeated. And that's normal grief. I think that's like, just allow yourself to have those moments, and there's nothing wrong with that. So
yeah. I think another thing that happens too, which is good because you're a relationship counselor, is that roles change in relationships and at work. There's a lot of anxiety I hear about people getting diagnosed and not knowing how to handle their work situation. Do they keep it secret? There's a lot of people that keep it secret.
Yeah.
So it's not just like your loved ones, but just your roles. Or is it just that you're afraid of what you're going to lose, not what you're losing?
Yeah, I think both. So to touch on, I guess we can touch on the anxiety thing, is like the idea that the what ifs, the idea that, what is this going to be like? And specifically with the role changes, the anxiety of how is this going to affect my loved ones? Because I think a lot of us, going back to being human beings, like are pretty selfless. The idea is like, I was never really afraid. I worked in hospice for 2 years. I was like, I'm not afraid to die. I'm not afraid to die. I'm not afraid if anything bad happens to me, until I had my daughter. And then I said, oh my God, I'm terrified, because I'm terrified of how anything that happens to me will impact my husband and my child, and I think that is such a real fear for people and a real anxiety. I know it is for me, and for anyone. And so with Parkinson's disease, particularly because it's it's a later in life disease, that you typically have established family relationships, and how is my illness going to impact them, going to impact my work? How is this going to change our relationships? And I don't want to feel dependent, and I don't want to feel vulnerable, and I want to feel in control, and I've lost that. And so that's very scary, and normally, bringing about a lot of anxiety that we can that can be managed. 100% can be managed. But it takes practice.
Okay. So that's really interesting. So it makes me think, going back to Parkinson's specifically, and how it affects your relationships from a physical therapist point of view, and even a speech therapist point of view, is that it affects your ability to communicate. And so that's something that therapy, I feel like could help with, especially because Parkinson's can, I mean, even just the small things you don't think about, it takes away your ability to, verbally
to emote,
communicate. Yes, verbally communicate, finding words, getting them out, being loud enough, being heard and understood.
Yeah.
And then changing the tone in your voice, which, people rely on to pick up on cues. And then there's the nonverbal cues where you don't blink as much, you don't swallow as much, you don't use your hands when you're talking, and you don't move your face. So
yeah, I love that you brought that up, because I think that's so crucial, because we know that I can't remember the exact statistic, whether it's 97 or 93% of communication is nonverbal. So when you start to lose that, the way that you and your partner or your loved ones communicate is absolutely affected. And so how does that fall on your loved one? How does your inability to emote or communicate like you used to, they can potentially personalize that. And I think that makes sense. And at the same time, you have the opportunity for education and the ability to say, I understand that I'm not emoting, or I may not be expressing myself the way that I used to, but this is how I feel. And I think that's where couples therapy comes in, to be able to help people communicate in a new way about their deeper feelings that may not be expressed nonverbally anymore, and to say, hey, this is kind of my new me, and it doesn't mean that I don't love you and don't appreciate you. And I think that's such an important thing to acknowledge, because we don't really realize how much nonverbals impact our little caveman brain when even even when you don't have Parkinson's disease. I know if my husband comes home and he doesn't make eye contact, or yeah, of course, yeah, I'm like, why are you on your phone, and I feel sad, and so we have to have a discussion about that. And we kind of come to an understanding that's it's not you, I was just doing this or that, and okay, well, that makes me feel better that I understand that. So I think that's an awesome point, because that's like a subtle effect of the disease that impacts your relationship that maybe you guys aren't even talking about. So it's important.
That's really, really great. Thank you. So that makes me think about caregivers or care partners. So what about their mental health, and what should they look out for as far as taking care of themselves?
Right. I think a couple things. I think that with role reversal, it's an adjustment, and you have to find the things, anxiety, depression, grief, and loss are happening to them too in a different way, because caregivers really are present with you during those times, and they feel a responsibility. Just because I always go back to human connectedness, is that we as humans feel a responsibility. We feel this attachment. We feel this need to connect to each other and care for each other. And when we feel like we're failing at that, that's a deep cut. And I think a lot of caregivers oftentimes probably feel like they're failing at that. I think that's a really common caregiver complaint, is I'm not doing good enough. I'm not doing enough. They still feel sad. They still feel this way. And I feel sad, And so I think as caregivers, you have to understand that the disease is not just affecting the person who has it. It's affecting you too, in the way that you want to love and care for this person and fix it, but you can't fix it. So if you can't fix it, what do? Right? You cope with it, and you strategize, and you build your toolkit to help you get through tough times.
And it's interesting with Parkinson's disease specifically, because these changes to your body and your voice and your ability to communicate happen so slowly over such a long period of time that you lose your ability to perceive. And if you guys if this resonates with any of you, please share your experiences in the comments. If you want Ashley to help you work through them, or have any pointers. And I'm sure it would make other listeners, because we know y'all aren't alone in this one. But I don't know, I'm just really thinking about relationships after the more we talk about it. it's important that you have a good relationship with a loved one as close as possible, because they are really helpful in giving you feedback. If they can find that sweet spot between nagging and being supportive.
It's a sweet spot, baby. Yeah, that's a real sweet spot. It takes some time.
Tricky position to be in as a care partner, and it's also a really good opportunity, though, if you could have a chance to get closer and connect.
Yeah,
it could be closer than
you
ever were.
Absolutely, because I think as heinous as any kind of like medical diagnosis is, the fact of the matter is, when we hold our loved ones close in those times, those are the times that we really understand that they are there for us. Mm-hmm. And if we push them away or try to be strong and not allow them to come in and hold us close and comfort us, then we're losing that opportunity for attachment and bonding that's so important. And what we're learning more and more about attachment research is that we're learning that this bonding doesn't stop in childhood. You know, we have our childhood attachments, we attach to our parents, and when we get out of the house at 18, that doesn't stop. Or, you know, people say millennials get out a little later, but I left at 18, and technically I am a millennial. So I just want everyone to know I got out of the house I got out of the house on time. But it doesn't stop. You know, you still need that connection, you still need that attachment, you still need that bonding and love, because what we're learning about the human brain is that the human brain craves that. We crave it, and I always say, like, I probably have said this already, we need love like we need air to breathe, and it's so true.
Yeah.
So,
and that's why, back to the physical therapy connection, that you should try to exercise with people that you love too. That's a good way for you guys to connect and bond. Mm-hmm. And you know, just be social in general. In a group class, being socially active is really important for just your overall mental health and quality of life. Mm-hmm. So it's a good exercise is a good opportunity to do that. I have a care partner right now who says, I annoy you because I love you.
Right. That's what I tell my husband.
Yeah, with Parkinson's, like, you know, you might not be aware that, you know.
Yeah. It's tough, man. We don't have Parkinson's, my husband or I, but I think we still annoy each other because we love each other. Yeah, that's a common thread.
Yeah, exactly. Every couple goes through this.
Yes, that's very true.
All right, so I am really excited. So what tools and resources do we actually have?
Okay, I'm so excited to talk about treatment options. So first and foremost, it is a brain disease. So let's talk about psychiatry, talk about getting on SSRIs or SSNRIs, which most people with Parkinson's I have found are typically prescribed these. SSRIs are selective serotonin reuptake inhibitors, and they help your serotonin, the happy chemical in your brain. And the SSNRIs just kind of throw in that norepinephrine as well. The other thing besides medication, we know with depression and anxiety that medication alone or therapy alone is not as effective as therapy and medication combined. So if you're an individual with Parkinson's and you don't have a partner, do individual therapy. If you are in a partner relationship and you have chronic disease, I really highly recommend doing emotionally focused couples therapy, which is the type of couples therapy that I'm trained in, and it really talks about those deeper emotions associated with those feelings of vulnerability. The other option too is we know that cognitive behavioral therapy is really helpful with depression and anxiety. When it comes to grief, it's a little bit different. Grief is not a cognitive problem. Grief is a natural thing. So I think that a lot of times with grief is we just have to be allowed to feel that, supported in that process of grief, and not feel like we are beholden to anyone to change our expression of that grief. And that's why therapy is such a great place to do that, a safe place to do that. Mm-hmm. With depression, the whole depression, and with apathy, the idea that we feel like we can't get out of bed, we can't do these things. One of the things that's really important is that we move away from mood-dependent behaviors. So typically, if I feel like really sluggish, I want to lay on that couch and watch Netflix all day long because I just don't feel like doing anything, I'm going to do that because I feel like it. If we can move to mood-independent behaviors, your brain will catch up, and which is where you kind of come in. It's like, hey, I don't feel like it, but I'm going to enact a mood-independent behavior. Independent of my mood, I'm going to do this activity, and my brain will catch up. My dopamine levels will go up, my serotonin levels will go up, my norepinephrine levels will go up, and I'm going to feel better. Yeah. So when you feel that sluggishness, can I say that? Sluggishness? I don't think I can say that word. Sluggishness.
Yes.
Yes.
That was good.
Yeah, thank you. And so when you feel that way, do that behavioral activation. 3, 2, 1, get up.
Ooh, see, we don't know this.
Yeah, 3, 2, 1, get up. It's like rip the Band-Aid off.
Okay.
Like that's what I do in the morning when my alarm goes off. 3, 2, 1, sit up.
That's a good anti-freezing technique as well.
Actually. Oh, really?
Yeah.
Oh, cool. Yeah. I didn't know that.
Yes. So are there any other ones that you know offhand?
Yeah, so for anxiety, mindfulness is really important. And also gratitude. I think this is so important. So what they've done a lot of research on gratitude lately. And what they found is when they've done depression studies, the depression levels go down the most with gratitude exercises versus self-focused exercises, which is really interesting. So, and what they found was people I think it was the exercise was write a letter to someone who's done something wonderful for you that you've never gotten to thank and give it to them. And with that particular group, their depression levels went down, their happiness level went up. And what they recommend doing is maybe just jotting, you don't have to have a full gratitude journal, but if you jot down what you are grateful for, and I think this was really pertinent when I was at Trinity Terrace with you and we were talking to Parkinson's patients, and one of the main themes with patients who felt pretty good about where they were at was they were really grateful for their life that they have had. And not about grateful for money, not being, grateful for physical things, but being grateful for relationships and experiences. And another really interesting point about gratitude that I learned from Savvy Psychologist, she has a podcast, is that don't do it every day. Do it a couple times a week, because you start to have a tolerance building to gratitude, which is really weird. Yeah, so you don't have to think about it every day, but just give yourself a couple times a week to jot down experiences and people you're grateful for, and that really is helpful. Mindfulness is really helpful. You can go on YouTube and pretty much Google, mindfulness meditations. People find that they do about 20 minutes of meditation a day is really helpful in reducing their anxiety and stress.
Even 10 minutes a day, the research shows.
Oh, really? Okay, even less than that.
Yeah.
Well, good, because I can barely do. I'm a therapist, and I'm like 20. I'm like, oh, I really got to focus.
Yeah. Let's talk about what is actual mindfulness meditation and what can people expect, and because I think it sounds kind of intimidating.
Oh yeah, it so is. I went to a yoga studio and I was and it was a meditation, and I was just fidgeting. So I think you got to find one. I think be okay with what's comfortable for you. There's lots of different types of meditation. There's guided meditation, there's silent meditation, there's kind of imagery meditation where you close your eyes, you're walking to a lake. What does the lake look like, and what does your peaceful lake look like? I personally really like a mindfulness meditation called acceptance of thoughts and feelings. And what you do is you just sit there, close your eyes, and listen to the prompts. It's about 15 minutes long, and basically you focus on your breathing. That's a big one. Focus on the breath. And what I love about mindfulness is its acceptance of the moment without any judgment. So it really grounds you emotionally. And what that does is it just says, hey, however you're breathing is fine. However you're thinking is fine. Your thoughts are going to come, your thoughts are going to go. You may find yourself worrying. That's okay. You may, and it just lets you accept and make space for anxiety and painful emotions and say, these exist within me, and that is all right. and I'm going to make space for that right now and accept that as a part of myself. And I think that is so empowering instead of trying to push it away.
Mindfulness has a lot of support in the research, just so you know. Just so it doesn't sound like this like hocus pocus.
Right.
I mean, it really does with chronic conditions and with Parkinson's. Mindfulness is known to really help with this kind of situation. So also know that it's a very active process. Mm-hmm. You're actively tuning into your body and sensations and breathing. Mm-hmm. And
it's a practice.
You got to practice, and you get better at it with practice. But it's not easy.
No.
People get a lot of ease as a benefit of it, but don't worry if you're not great at it at first.
Right. Yeah. It's
really
hard. Yeah.
I can't do it unless it's guided. It has to be a guided meditation for me.
Yeah.
So there are all kinds of, if you go into iTunes.
Even, there's a ton of podcasts. I can't recommend just one. There's a
Meditation Station.
Yeah,
is good.
Yeah,
I like that one.
Okay, Meditation Station.
Let's get specific. There's also a really good app called Headspace. That's 10 minutes a day, and it's really good. It's free, I think. It's a free app if you have a smartphone. And it guides you through 10 minutes of mindfulness meditation every day, and so it kind of keeps you honest like that. Also, while we're on the subject of technology, you can write down your gratitude thoughts, 1 to 3 a day, or not every day, you said.
No,
but there are also gratitude apps that you can use where I did this for a while. You enter like things that you're grateful for, and it can kind of prompt you to think about things that you would be grateful for, and you can add images, and then it's kind of fun to look back on. But
sweet.
Yeah, it's really
that.
It's actually pretty fun. And you just kind of realize no matter how much is going wrong in my life, even on a daily basis,
mm-hmm.
there's so much that's going right,
mm-hmm.
and staying positive is going to be really important
mm-hmm.
if you're going to be combating something like this.
Yeah, it's a conscientious choice. It's not dismissing the pain of what you're experiencing, but it's a conscientious choice to focus on what's good,
mm-hmm.
even though there are things that are bad. So I think that's
exactly.
important.
Okay, so what other treatment options are there? So I thought it would be helpful for you to talk about how do you collaborate with your doctor, and when do you go see a psychiatrist?
Sure.
And medications.
So I think if you're taking any psychiatric medications, it's super important to either be treated by a neurologist, which I'm sure if you have Parkinson's, you have a neurologist, but also to see a psychiatrist. And it also is really important too. I think people don't understand that most psychiatrists only prescribe medication. They don't do therapy. Okay, so if you go to a psychiatrist and they want to check off a list of symptoms and treat you for those symptoms, they're not being rude. That's in fact their job. Psychologists often do testing, cognitive testing and things like that, and assessments, and they oftentimes don't do therapy. There are some psychologists that do, but like I'm a licensed clinical social worker. I specialize in therapy. I don't do any kind of medication management, and I do very brief assessments. And so when should you go to the doctor? I think if you're experiencing symptoms of anxiety consistently, if you're having panic attacks, that feeling where your chest is tight, where you feel like, oh my God, is this a heart attack? My throat is closing up, racing thoughts, depressive rumination, which gratitude is actually the opposite of.
What's rumination?
Oh, okay, thank you. Yeah, rumination is just kind of rolling over the same type of thought every second, pretty much. You're ruminating, you go to close your eyes at night and think, oh my gosh, this happened at work today. Oh my gosh, this happened at work today. This happened at work today. And I know it sounds like a little manic when I say it, but that's kind of the way our minds kind of roll. It's like the hamster wheel, so to speak. Mm-hmm. And if you find yourself doing that for more than 2 weeks, I really suggest that you make an appointment with a psychiatrist or talk to your existing neurologist if they have a referral. And again, I think it's really important to engage in individual or couples therapy in conjunction with your medication, because what you're going through is tough, and use the tools that are available to you, please, because they work. We know they work.
Mm-hmm. it's quite treatable. That's what's great about it. It's
Yeah.
just like identifying it, I think, and just accepting it too. I think
Yeah,
a lot of people, you know, that's getting better with education and advocacy and everything. But the truth is, this is very, very common, and there are resources. So hopefully, y'all will have a better way of what to do about it after this and with this. Okay. Any other treatment options? I feel like
We're going to talk about
okay, so
that.
Yeah. So let me ask you this. So how does somebody find a therapist in their area? Or how would we find you if we want to ask more questions?
Sure. So if you're not in the Fort Worth area, Psychology Today is a great resource. You can find a therapist online. I always advocate for them because you can search by pretty much any demographic or problem that you need. You can find me on staffordhealing.com. That is 2 F's, staffordhealing.com. I'm actually having a couples workshop, which is wonderful. It's in Richardson, Texas at the Spring Hill Retreat Center, June 22nd and 23rd. And if anybody's interested, they can go on to staffordhealing.com, go to my booking services and book the couples workshop just for one person. I know it's for you and your spouse, but the way it's set up is kind of weird. So you can register there, or you can just email me at Ashley Stafford at staffordhealing.com, and I'm happy to answer any questions you have, or direct you wherever you need to go, whether it's to me or another therapist. I'm very happy to do that, and I do it frequently.
Okay, Ash, would you address some of these comments
Sure.
that we've had? If you guys have any questions for Ashley before we go, let us know. I think. Okay, so
3, 2, 1.
3, 2, 1, get up. I love that.
Yeah, I love that too.
All right, so we posted in the comments the podcast that Ashley mentioned that is by
Quick and Dirty Tips. That is it. Quick and Dirty Tips, Savvy Psychologist. She really helps me, and I use not only with my private clients, myself, but also patients that are coming into the psychiatric hospital. Because no matter where you are in your level of distress, these tips are good. I mean, they're really great. So
great. I think that's all I see, unless there's more there's more comments that, there's 20, so how do I?
Let's see.
I'm only seeing 5 comments for some reason.
Yeah, it's really weird. Why is it doing that?
I don't know.
Okay, it says 2 shares and 20 comments. I don't see anybody else's comment. If you guys have more comments, or if you feel like we're not addressing your comments, can you rewrite them?
Yeah, if you're still here and you want to rewrite them, they'll pop up for us. I don't know why it's not working, but we will address them after the show.
For sure.
Ashley will go back, and I'll go back and answer your questions.
Absolutely.
And I apologize for that, guys, but we're all new to this technology. At least I am.
I am too. I tried to do a Facebook Live earlier this week. That was a bit of a fail. So this is a way better experience than what I had last time. So I really appreciate it.
Okay, well, thank you so much for being here.
Thank you.
I'm so excited
and thank
to have
you
you as a
guys.
resource. Yeah, you guys, you're doing great. Next time, and we're going to talk with Marie. She's a pelvic floor specialist. And I figured it out, I think.
Oh, see, there they are.
Here we go.
Oh wait, we found them. We found your comments. Okay.
We found them. Stick around. Okay, can you address how CG can approach apathy in a spouse or a parent?
Sure. Yeah, a caregiver. I think, one, it's really important to come from a loving, compassionate approach. I think when we see apathy in our partners, regardless of the cause, whether it's Parkinson's or whether it's something else going on in their life, we feel that connection with our partner feels really threatened. And when our connection with our partner feels threatened, our brain doesn't understand the difference between emotional and physical pain. And so that threatened connection feels very triggering and it feels really scary. And I think we first have to acknowledge that as caregivers and as partners of someone struggling with something, that is really scary for us. What's going to happen? Are they going to be there for me? Do they love me? Do they care about me? And I know that sounds selfish, but it's not. It's a normal response to feeling a very precious connection being threatened. And so acknowledge that this connection is precious to you, and that's why you're concerned. So, and then just talk to your partner. If they're feeling apathetic, I think acknowledge that it's part of the disease process and talk to them about it. This is how I'm feeling, and also kind of cushion that with, I know you love me, but I really need some reassurance right now. It would really make me feel good if you know, whatever it is that you need to feel that reassurance. I know you're feeling like you don't really aren't having a good day, but like if you could just hug me right now and tell me you love me, like that would really make a difference for me. And I promise you, 9 times out of 10, your partner is going to be thrilled. The Parkinson's patient, or even if they don't have Parkinson's, is going to be thrilled that you came in and said, what I want right now is like physical connection with you and a hug and love and a kiss and just saying I love you and it's not about you and you're so special to me. And as a caregiver, if you're feeling that apathy from the patient, just tell them, I'm feeling insecure. I'm feeling like this apathy is directed at me, and I know that's not right. I know that's not true because I have this information, but it still feels like that. Can you hug me and let me know that's not the case? And that really, for me, it really helps. Yeah, when I just say that, I know it's not about me that you had a bad day, but like I really feel.
I'm really glad you brought that up because
sad,
actually I think intimacy is something that we should really actually touch on.
Okay.
Because like we said, there's the communication barrier sometimes with Parkinson's, and then a lot of it just comes down to like, how do you be intimate? You know, it doesn't have to be, I don't know, do you have any thoughts on that? Like, even if you're just close and you're cuddling, there's other ways to be intimate that...
Oh, besides sex?
Besides sex,
okay,
yeah.
We're going to get right to it.
We're just going to get right to it.
Yeah, absolutely. So, yeah, there's other ways to experience intimacy. I think that, like, everyone's different. There's, like, the 5 love languages, which I think is great to kind of talk about what people experience as emotional bonding. Like, what is your... Like, is it if somebody does something for you? Is it if you get a gift? Does that make you feel loved and cared for? Is it a compliment? Or is it just doing an activity together, like we're going for a walk? Or a lot of people like that physical touch, that physical affection really makes them feel bonded to their partner and cared for. And I think that's just part of the communication. What makes you feel attached and bonded to your partner? Everyone's different. Some people could care less about sex. I mean, really. I mean, some people are like, that's like whatever, but a back rub or a foot rub, like, just really just like, woo, like makes me swoon, you know? I mean, so, and there's no right way to do it, guys. I mean, you can't watch TV and think life is like that. It's not true. I mean, their intimacy exists on many levels. So ask your partner, talk about it. What's important to them? What do they love for you to do for them? And what do you love for them to do for you?
Yeah. And, you know, besides sex, there's ways to be intimate, but there are sexologists, right?
Yes, there are, and I am not a sexologist, so I'm probably, I kind of deal more on the emotional aspect.
This is another resource.
But yeah, absolutely. But emotionally focused therapy does touch on intimacy, and in the retreat. Couples retreat and workshop we're doing June 22nd and 23rd, one of the conversations that we have is about sex and intimacy and how that because sex is really vulnerable, it kind of makes us kind of like, oh, I don't know if we can like talk about what I like or talk about what I want to be done or talk about what I like sexually. And so I think opening up that vulnerability again is really the entry point, no pun intended, to you know, to connection emotionally and sexually.
Yes. So intimacy is important. There are resources. That's what I wanted y'all to know. There are resources for that. And there are other ways to be intimate besides sex. But anyway, just know that that's out there. There was a question, if you're in DFW, what is DFW? Dallas, Fort Worth, Texas. Yes. We're in Texas. It's really hot right now. I have my own practice, Fort Worth Balance Therapy Center, and Ashley practices here in the Dallas Fort Worth area as well. So if you guys want to find us, www.balancetherapyllc.com. And Ashley gave you her website. Do you want to do it one more time?
Sure. It's www.staffordhealing.com.
Perfect. And Allison Geimer, she couldn't be here with us today. She is doing family business, but she is going to be back next month when we talk to Marie, and we're going to talk about
Marie Warner.
Awesome.
Yes, I love her.
We're going to talk about bladder symptoms, bowel symptoms, and how it relates to your pelvic floor, which is made up of muscles, and coordinating those muscles is important. So I feel like that's something that could be missed a lot in Parkinson's. So we get to learn. I'm excited. We get to learn a lot about that.
I'm excited for that too.
Okay. Thank you guys so much for being here.
Bye.
And bye.